Hello everyone, and welcome to today's webcast. Before we begin, we would like to cover a few housekeeping items. At the bottom of your audience console are multiple application widgets you can use. You can expand each widget by clicking on the maximize icon at the top right of the widget or by dragging the bottom right widget corner. This webinar is being recorded, and the recording will be available one day after the webcast using the same audience link. A copy of today's slide deck and other resources are available in the resource list widget. It's a green folder at the bottom of your screen. If you have any questions for presenters during the webcast, you can click on the Q&A widget at the bottom and submit your question. We will try to address as many questions as possible during the event, but if a fuller answer is required or we run out of time, your question will be answered later via email. We do capture all questions. If you have any technical difficulties, please click on the Help widget. That is a question mark icon and covers common technical issues. You can also use the Q&A widget and submit your technical issues there. Now I'd like to pass it over to Claire Gibbons. Claire, you have the floor.
Good afternoon and good morning, everyone. Thanks so much for joining this webinar. It's a learning exchange, and this webinar is Measuring Up, Learning About Improving Equity from Australia's Early Childhood Development Census. We're so glad that you're joining us today. We have a really great and packed agenda for you. We're going to start out with Kim Boller, who will be presenting findings from the Australian Learning Exchange. Then we're going to move right to Yasmin Harmon-Smith, who will talk a little bit about Australia's Early Development Census. Then we'll have some responses from our panel, Ephraim Aguilar and Debbie Mathias, and then we'll move to questions and answers with you all. As you heard Brian say, please go ahead at any point and type in your question and answers into the online widget, and I will moderate that discussion at our end. So be thinking about your questions as we go through, please, so we can have a great discussion once the presentations are over. So let me go ahead and introduce all of our really wonderful speakers and panelists today. You're going to hear first from Dr. Kimberly Boller, who is a senior fellow at Mathematica with over 20 years of experience studying early childhood services and systems and focusing on the effects of child care and early education, parenting programs, and policy related to children and families. And she led our learning exchange to Australia, and she'll be talking about that. Our next presenter will be Dr. Yasmin Harmon-Smith. She's the Deputy Director of the Fraser Mustard Center and Child Health Development and Education Group at the Telethon Kids Institute. And her team supports the Australian Early Development Census, providing support to states and territories in Australia using population data across different levels for planning and monitoring. Then we'll have Debbie Mathias as part of our panel responding to our presenters. Ms. Mathias serves as the director of the QRIS National Learning Network with the BUILD initiative, a broad cross-section of partners at the state and national level focused on early learning system building, including the development and implementation of quality rating and improvement systems. And finally, we'll have Ephraim Aguilar, also part of our panel. He has GIS activities for the Center for Healthier Children, Families, and Communities at University of California, Los Angeles. He applies cutting-edge GIS and web-based technologies to support planning and evaluation practices that emphasize the impact of neighborhood conditions on individual and community health. And last and least, I will be your moderator today. My name is Claire Gibbons. I'm a Senior Program Officer at the Robert Wood Johnson Foundation, and I'm very pleased to be hosting today. I will stop there and remind you all one more time to enter your questions for our presenters and speakers into the widget online, and we'll get to those after the presentations are over. So Kim, I will turn it over to you.
Thanks, Claire, and welcome on behalf of Mathematica Policy Research. On behalf of Debbie Mathias and the 5 other members of the Learning Exchange from the U.S. that are pictured here, we want to thank the Robert Wood Johnson Foundation, the Australian government, Sally Brinkman and her team at Telethon Kids Institute, and all of those who extended such kind hospitality when we attended the Australian Early Development Census Conference in Melbourne, and then spent time in South Australia meeting with policymakers, program leaders, and Sally and Yasmin's team in Adelaide in March. The goals of the exchange were to learn more about how Australia came to fully implement a census and use that information to drive policy and programming. We were also interested in what that looked like on the ground. To get on the same page, let's review what we mean in early childhood by holistic, population-based measurement. Here we're talking about what a whole child looks like and at development across domains. By population-based, we mean how all children are doing, not just a sample. Bringing that together, that means measurement of how all children in a given geographic area are doing across developmental domains, looking at well-being in multiple areas of development. Are they on track across the board, or do they have areas where they may be vulnerable or at risk for falling behind? In the measurement area, the Early Development Instrument is one tool that has emerged to meet these needs. Keeping in mind it's not the only one, but you'll hear a great deal about it and its adaptations and uses today on our webinar. The Early Development Instrument is used internationally, and it's the basis for the U.S. and the work in Australia. A team from Canada, from McMaster University, at the Offord Center, developed the EDI and collaborates with many country teams from all over the world. The article that you see here from Early Childhood Matters by Magdalena Janis and Carolyn Reed Westaby provides a great overview of their work. A question that we received in advance of this webinar asked about whether this measure has been used in low and middle-income countries, and yes, it has, including in Peru, Chile, Vietnam, Indonesia, and many more. What is the EDI? It's a teacher report. It's completed in the first year of children's schooling. It's about 103 items across 5 different domains. It takes about 20 minutes for teachers to report on per child. It does provide this picture of children's developmental health across all of these different domains in a specific geographic area. Again, it's a place-based, population-based measure. You would do it for all of the children in a given school, for example, in a given county, in a given state. And again, as I said, versions are available across 20-plus countries. And there's a short form, 10 items, that's used in surveys that was developed by UNICEF in country surveys. Let's look quickly about the domains that we're talking about here that are assessed. The Australian version adapted from what was developed by the folks in Canada. What we see here in this holistic assessment, 5 domains are assessed: physical health and well-being, emotional development, social competence, language and cognition, and communication skills and general knowledge. The teacher ratings that are conducted, again, sort of fall into these areas. And what you see here in the communication skills and general knowledge domains, the well-being of children is bucketed into 3 different areas. Are children developmentally on track? Are they at risk? Or are they developmentally vulnerable? A major indicator across looking at children is the number of vulnerabilities across these domains of development. So how does this look when you look at what's happening in the United States? How has population-based measurement been used here in the U.S.? In the U.S., the UCLA Center for Healthy Children, Families and Communities, and you'll hear from Efren Aguilar in a moment, who represents the work there. UCLA holds the license for the EDI work and is in collaboration with 75 different communities in 16 states. This work began in 2009 in Orange County. They were the first to use the EDI community-wide. California has a number of communities that use the EDI, and the Los Angeles report that you see here is one example of the type of work that's been generated. Note that population-based measurement exists in other areas of early childhood and in cradle-to-career programming. Promise Neighborhoods is one example, and the Strive networks are another example that we're talking about that use population-based measurement. For example, the Government Performance and Results Act data collection under Promise Neighborhoods is an example of community-wide initiatives that are using population-based measurement. They may use the EDI, they may use something else. Education is another example of population-based measurement, state standards and testing, kindergarten readiness assessment, and in public health we have other examples including vital statistics data. One of the things that gets people really excited about use of population-based measurement is the ability to map how children are doing. Thanks to Christy Anderson, Keith Welch, and Renat Fried at Oakland Unified School District for these graphics. You can find these on the web. You can follow the link that's here, and you can see these for yourself. That's the other thing that this kind of measurement allows for, the EDI in particular, and the work at UCLA Center. You can look at this. It's very transparent. These are very dynamic displays. This mapping reflects the most recent EDI collection after it's been processed through and returned by the UCLA Center. And these compelling displays, what you see here is the 5 different domains, the percentage of children on track in all domains by zone in Oakland itself. Know that the darker the blue here, the more children that are on track developmentally, with the darkest being from about 83 to 91% of children, and the lightest from 59 to 67%. The dashboards that are available allow stakeholders to look at this by all types of demographic data and other contextual factors to both confirm ideas they have about what's happening and beginning to pose more questions. But it's important to note that there are children who are not on track in every zone, and Yasmin will return to this in a moment. So when we think about the origins and scaling of the Australian version of this, and this is from a presentation that Sally Brinkman presented at the AEDC conference in 2015, it really is quite an evolution story. In 2002 to 2003, Sally and the team and her team were asked to think about reallocation of services in Australia, but there were no data to guide that. There were 2 groups that were interested in the EDI at the same time, and they both were asking the folks in Canada, how can we go forward with thinking about the EDI in Canada? And in the early to mid-2000s, there were some scholars who visited Australia and thought a lot about and talked to government, talked to folks there, and emphasizing ECD and data for decision making. There was a small interested circle of government, philanthropy, and researchers interested in early childhood and the use of data for decision making. There was funding that came together, again, sort of these ducks all lining up in a row to be able to fund an early pilot of the Australian Early Development Instrument in 60 communities. 70,000 children were participating in that. That became the basis for a longitudinal study that showed the predictive validity of the Australian version to other outcomes. And in 2007, funding was provided for the Foundation for a 2009 census, along with a lot of support, and it was the result of political advocacy and an extensive investment. And it really was the collaboration between the Australian government since 2002 it was the Government Department of Education and Training working in partnership with the Centre for Community Child Health at the Royal Children's Hospital in Melbourne and the Telethon Kids Institute. So this implementation and the national implementation really evolved into full government ownership from 2012. National contractors were selected, and a more central oversight. A central platform was improved, and the AEDC became embedded in program and practice. And in 2015, this resulted in over 302,000 children being assessed or reported on by over 16,000 teachers in 7,500 schools. The goal is 95% of children being reported on in 95% of schools, 95% of children in 95% of schools. The cost is about 25 million Australian or 18 million US across this 3-year period of collecting the children's data. This includes time for the teachers to be relieved of their duties during the data collection, which happens in the second part of the children's first year of formal schooling. In 2018, in August, was the end of the 4th round of data collection. The supports also include ongoing support for quality improvement and the use of the data. So what did we learn from going to Australia, from seeing the use on the ground? What we learned is that the groundwork, again, measurement work is not often seen as so exciting, seen as so enthralling, but that has to be done to put into place the measures that were, and the measurement work that was the supports for showing it is predictive of later outcomes, and that was compelling to government. This common tool is powerful for showing the strengths in communities and the gaps that need to be filled in. The use of champions provided the momentum that was needed. Local ownership was amazing. We were able to walk into programs where they were able to point to their data and say, this is what we're using to make changes on the ground. And everyone pointed to the idea that the taking up by national government really made all the difference in providing the scaffolding and supports. The real lessons, though, for policy, advocacy, and research were also very compelling. The community-level repeated measurement and the support for that over time, people recited it over and over again. It was that it can be counted on, it can be built on, and that is really what has been able to help to provide a support for showing folks, here is what we see in our data over time. We see improvements across the board in all of our communities. The language people use to talk about children's development, on track, at risk, vulnerable, really does matter. It isn't that we're talking about a specific group of people, a specific type of community. Language really matters here. And also that, again, the Australian dialogue and the ability to have population-based information answers certain kinds of questions and generates different types of questions. I'll leave you with a quote by Pat Bowie, who came on the exchange, that really talks about the idea of the data building over time and connections to it. The one thing that really stands out here is the moving beyond. Most people have moved beyond simply questioning the value of the data itself. Instead, they're looking at how to see themselves in it, how what they're doing fits in, and questioning how to improve their practice. Let me turn it over to Yasmin now to dive more into what they've been learning in Australia and share that with you. Yasmin.
Thank you, Kim. So much like the US, we started in Australia with the idea that the EDI, for us, the AEDC, provides data for communities to be able to do something locally to improve conditions for children and families. But it has become much more, and that's a bit what I'd like to talk to you about today. It is informing our national policy debate, and Kim alluded to some of this in her presentation. This is the first collection of data in 2009, and you'll see those coloured points in the left-hand column are where the state sat in terms of their percent of children who had developmental vulnerabilities in any domain. As you can imagine, states are quite competitive and they all want to be the best. They want to have the best systems, the best education, the best outcomes. So this was alarming for those jurisdictions that weren't clustered. And even in the jurisdictions that are clustered there at the bottom of the graph, you can see that there are some that are doing relatively better than others. We had some big changes to our universal preschool in 2010. So the reason I'm talking about this is to set it up for the next slide, so bear with me. But this went from, we have a very good universal system across most of the country, but in Queensland we had only around 30% of children in a 4-year-old preschool program due to some changes in 2007 across the country. And so Queensland, if you had a look at the previous slide, was one of those higher up dots. Only around 30%, as I said, children attending preschool. If you have a look at what happened after that, the green line, or the teal colour that comes down quite steeply, that is around a 4% drop in vulnerability across the entire state. And what was different about 2009 and 2012 in Queensland was around 30% in preschool in 2009 cohort, and in the 2012 AEDC cohort, around 70% of children went to preschool. So these sorts of things have, in the state data, are having us ask questions about what policies we enact and how those support children and families in the early years, and what more we need to do. So some of the examples of the research that have come after this, so a lot of people were asking questions about what happened in Queensland, and we all had speculations about the preschool, increase in preschool uptake. So this was work conducted by Sharon Goldfeld and colleagues at the Murdoch Research Institute, and you can see that here the children who attended preschool from an advantaged community had the lowest levels of vulnerability. Those who did not attend preschool but lived in an advantaged community had higher vulnerability than those that did attend preschool in those communities. Children in disadvantaged communities who attended preschool had lower vulnerability, again, than those who did not. So this was a real cross-sectional study, and we can't draw any conclusions, but it really is starting to point to some of the sorts of things that we already think are really important, but which we're now able to gather more evidence across the country. And why? Why does it matter? So we often wonder whether developmental vulnerability on the AEDC, and this is one of the questions we get asked quite frequently, whether it does in fact mean that children will stay behind. And Kim again spoke about some work that Sally Brinkman and colleagues did linking the AEDC to literacy and numeracy testing results from the pilot cohort. There were around 1,800 linked cases, so this was the first community and first lot of community results that we had. And you can see here that children who had no vulnerabilities on the AEDC at school entry were performing better as a group on the whole than those children who had just one vulnerability, who were again better than those who had two. And by the time children were vulnerable across all 5 domains, the majority of those children were also falling behind in their literacy and numeracy. So this is standardised numeracy and literacy testing that happens across Australia. So how are people using the data on the ground? It is, like I said, it has moved beyond the community level. We're using the data to inform state systems, and I'm going to give you one great example of that, of recent work in this area. Don't worry too much about the content on this slide. It's really for illustration purposes. You can see that this is from work happening at the Better Start group at the University of Adelaide, led by Professor John Lynch. And the blue circles are all the data sets that they have managed to link together, mostly administrative data sets. The AEDC sits in there among child development, and people are now able to come and start to ask questions of these data. John was funded by the South Australian Premier to do some work to examine the impact of child protection notifications on children's development following a royal commission into the child protection system in South Australia. So they wanted to know whether the experiences of the children mattered for their development. Obviously they do, but what's the extent of the concern? So we know that we have a high number of notifications, and it's always increasing, and the child protection system can never address them all. And this work wasn't entirely new in terms of thinking about how many children these notifications pertain to, but it was quite different in a few aspects. So the first alarming thing was that 1 in 4 children are notified to the child protection system through mandatory reporting before the age of 10. So that's a lot higher than what anybody, I think, expected, even though we've seen these sorts of figures before, and it's not unusual. It's very consistent across our country as well as across other international contexts. What I think people do with them when they see this number is think that these kinds of notifications are the worried neighbour, the teacher who's concerned about what the child had in their lunchbox, and that there may not be real concerns. And then when we move down this list, you can see that that drops to 1.8% of children in out-of-home care, 5% of children with substantiated notifications, and that's sort of more the idea of what people think about in terms of statutory responses for child protection. What John was able to do, and again, don't pay much attention to this, was to demonstrate the impact on children's developmental vulnerability based on whether or not they had a child protection contact. So if you look at the first column there, so this is for children's social competence, but it's fairly similar across all of the domains. 7.6% of children who had no notifications to the child protection system had a vulnerability in social competence, and that increases steadily across the categories of substantiation, with the most severe category, those children in out-of-home care, having around 35.2% of children with a developmental vulnerability on that domain. So that's huge, and in terms of a service system response, it means that child protection alone isn't responsible for these children or for what happens to children in the system. So what are we doing with these notifications? And this is an example of a graphic that the South Australian Department for Education uses to think about how they respond to vulnerability, with around 70% of births falling into a low-risk category, 2 to 5 risk factors affecting around 27% of the birth cohort, and around 3% having highly complex situations with a large number of risk factors. This looks different again for our Aboriginal and Torres Strait Islander population, where there are far more families with a higher number of risk factors. And the question for the service system is, how do we deal with this? How are we dealing with this in a culturally appropriate way? And what does it mean for our systems and for our staff training, etc.? So what's happened in Australia is some reform. There is a new program being trialled. It's around connecting families who have been notified to the child protection system but do not meet the threshold for a statutory response. It's about connecting those families to caseworkers and to systems that will support them before the child protection notifications escalate and become more serious. So what John was able to demonstrate in the data was that those first notifications are very rarely the last, and that by the time children have 3 or 4 notifications, things are starting to get far more detrimental in terms of outcomes, so that we needed to intervene early and in a preventative way. So as I mentioned earlier, the statistics around Aboriginal Torres Strait Islander families in the data clearly show that we need to be doing things in socially and culturally sensitive ways. We need to be ensuring that there is good, strong linking to local services and pathways, so that families who are potentially facing these challenges that we're really identifying quite early through this notification system are in fact prevented from escalating further. I also wanted to show you an example of how a community can make a difference, and I've chosen an example here that is a bit unusual and it's not something that people generally show. The reason I like this example is that they didn't focus on a single domain and think about how they can reduce developmental vulnerability in that domain. Instead, they really thought about how they could provide conditions for families and children to succeed. So this is an example from Westfield Park Primary School that was actually shared at the AEDC conference in 2018 by Steve Soames, the principal of that school. And this is their data from 2009. And when Steve started at the school in 2011, he started getting information about the upcoming 2012 census. And he was really interested to find out what exactly this census was and why they needed to do it as a school. He downloaded their 2009 report and was staggered by the proportion of children coming into his school already behind in their development. They obviously knew that they had difficulties in their school and challenges, but for Steve it was really striking that these had already started well before the children engaged with the school system. So Steve did a lot of things in their school, but probably the most critical was that he employed a social worker, not to work as a social worker in the school system, but to actually connect with the community. So rather than having a school counsellor, the social worker's role was to build links with the community and to put the school at the centre of the community. Steve also did a lot of work with his teaching staff to shift perceptions of children and families in the local community. It would be reasonably fair to say that teachers in schools with really hard, complex issues in the community often become quite burned out and feel like they don't really have much power to make change. So Steve did a lot of work around trauma-informed practice for his teachers, and that really changed the approachability of teachers for children and families. You can actually have a look at some examples of the work that Steve's done on some videos online, and I'm sure we can share those at some stage through the webinar. But what it looks like now is some decreases in vulnerability that you might associate with the very small numbers of children. So this is an example of why at the community level it's really hard to track the change and whether it's related to what you've done versus what's happening more generally. And from 2009 to 2012, you can see that kind of fluctuation, because what Steve did started after 2012, and you would expect those sorts of numbers to bounce around when you have such a small number of children. But what you can see in 2015 is a really large shift in the portion of children coming to school with developmental vulnerabilities, and that is really very much related to the way in which the school has become a hub for families in the early years, a safe place where they can now come and they engage with the social worker to support them with their issues, as well as connecting to each other and to service providers. I think one of the key lessons that we've had from the AEDC, and that has shifted the way policymakers are talking about their services and supports and how they allocate resources, is this, which is very confusing to look at first, so let me give you a very quick explanation. On the y-axis along the top, along the side, is the proportion of children developmentally vulnerable. So the higher up the bubble is on the graph, the more children in that community, the higher the percent of children in the community who have developmental vulnerabilities. The lower down on the graph the bubble is, the fewer percent of children who are developmentally vulnerable in that community. Over to the left of the graph means that you're in a community with lower socioeconomic status or socioeconomic resources, and to the right, those are the wealthier communities. So we see a gradient, an inequality gradient, with the poorer communities having a larger percent of children vulnerable than the wealthier communities. But what's important about this graph is that you can see by the size of the circle, by the size of the bubble, that is the number of children who live in those communities who have a developmental vulnerability. So although we see higher percentages of children in poorer communities, we see much higher numbers of children in the middle of the socioeconomic spectrum, which is often an area that is not targeted by specific services and supports. Now I'm clicking through these slides. Oh, there we go. Sorry. So if we were to target children based on poor communities, we would miss, so those are the children to the left of this red line, we would miss the vast majority of children on the right who have a developmental vulnerability. In the same way, if we just target the areas on the map with the darkest shading, that would be those above this red line, we would miss the majority of, or more than half of the children with developmental vulnerabilities in communities that we wouldn't target based on the percent of children vulnerable. So here in this square is where the vast majority of our children sit. So if we want to make a difference at a population level, that blue line through the graph shows the slope of index of inequality. If we want to flatten that, that means reducing inequality across all communities with the greatest efforts needed at the end where the inequality is the greatest on the left. So the takeaway messages for us is that a national census has really allowed us to see how and for whom the system is working. So which families and children are able to access the supports that they need and to create the kinds of environments in which children thrive. And that means creating the kinds of environments in which families thrive. It's sharpened our research focus, so we're asking different questions and we're starting to get funding for answering those types of questions that often comes outside of the general research funding bucket. These are questions that governments specifically want answered, and they are putting money into research to answer those questions. We've enabled longitudinal research through data linkage that would otherwise be expensive and difficult and susceptible to all the sorts of things that happen in sampling, where we lose the families we're most interested in following, where we have trouble recruiting those kinds of families as well. So we have data on 95% of children every 3 years, and we can track it very well through our linked systems and into early adulthood. We can see interactions with the health system, with the education system, with services and supports, and that really lets us do all sorts of things that you cannot very easily do in a research study. So I think that's a bit bang for buck. And finally, we're able to identify trends early, which enables timely research. So at the moment, what we're seeing is real sharp decreases in vulnerability on language and cognitive skills domains, but at the same time, we've seen an upward trend in vulnerability on social and emotional skills. So we're seeing now researchers starting to ask, why is that, what are we doing, and how do we address it? So that is the end for me. I'm going to hand over to the panel.
Thanks so much, Yasmin and Kim, too. So we're going to have a couple responses from our panel, and we have a couple questions that we asked them to think about ahead of time. So, Ephraim, why don't we start with you in that first question? Do you want to take a crack at that?
Oh, of course. Yeah. Before I begin, too, I just want to say this is a very exciting conversation, and I appreciate all of the help and interest that you guys have in assisting us move this incredibly important work forward. So that said, in the U.S., let's see, one of the aspects of the U.S. that distinguishes us from the Australian or Canada experience is that our early development sector, if you even want to call it a sector, has a very distributed leadership, especially when you move down to the state, county, city, down to the neighborhood levels. So our federal government has not moved so quickly in implementing the EDI nationally as is the case in Australia. There's also a very early misunderstanding of the purpose of the EDI as a population-based measure within a space of competing KRAs. And I noticed that there are some questions that are coming in from the group. Hopefully we can discuss those more clearly. And while one of the common issues that we encountered were that various states had an interest in selecting, refining, or even developing their own KRAs. And while on the one hand it's a good idea for co-designing these tools in order to get full buy-in by state or community level partners, these boutique measures unfortunately can have the effect of undermining the level of comparability needed to learn collectively across jurisdictions. And then even more germane to this discussion, to assess equity. So currently more and more of our conversations with folks have demonstrated a generally more refined understanding of population-based measures. And as a result, folks are now seeing the EDI as an important added value to their work. So one of the things I thought I can also mention as well is that this is not unique to the early development space. But people often fight for their own quality measures for their quality improvement activities. And while this is great in that more and more folks are interested in continuous quality improvement, as I mentioned before, it makes learning across jurisdictions a bit difficult. Do you want me to get the next question too, or was there going to be reflection on this question, the first question?
Let's go ahead and move to, how have these data been oriented for use in the U.S.? Is that the question? Yeah, go ahead with that one, Ephraim. Thanks.
Oh, cool. So in the U.S., we were very explicit from the onset to use the EDI as both a measure to inform systems-level responses to help kids start their lives in positive developmental trajectories, but also as a social justice tool to explore equity in new ways, as well as harnessing the collective intelligence of our resident partners across the United States to address these disparities. What we're finding in our data is that risk and adversity are not randomly distributed in the U.S., but actually they fit these very disturbing patterns of concentration in certain communities. We know that the people living in these places understand with a much more nuance than, let's say, me or my partners here at UCLA, the impact of this adversity. They understand some of the root causes. A lot of them are longtime residents, so they understand the historical context by which these geographies of adversity were developed. And so because it's not a new thing for them, even though there's a pattern very much like that CIFA analysis that Australia provided, where there's a predictable pattern of, the more disparity or adversity in communities, the higher rates of vulnerability. What we're finding in our data, however, is that not all communities actually follow those patterns, and we have a lot of places that actually have exceeded all expectations and have developmental outcomes that are amongst the best in our U.S. cohort. And so there's a lot to be learned from that.
Great, thank you, Ephraim. So why don't we move to Debbie now? Debbie, do you want to go ahead and talk a little bit about this second question? What can we learn from Australia?
Yes, thank you. I think we were able to see the use of the data in place in communities when we did some school visits. We saw wonderful examples of schools developed to match with supports the needs identified in communities. And in the most at-risk communities, we saw just very robust examples of strong schools that were hubs and community and serving not only the school-age population, but as was mentioned before by Yasmin, the early childhood space. And so I think we could see terrific examples of how it played out in practice. I think that what's most exciting about what we're learning from the Australia experience is how with a consistent measure we can learn across communities and have peer learning from community to community. So communities taking and neighborhoods taking a hold of their data, understanding what it means with what Ephraim said about the nuance and the context of and the historical context of the community, informing the use of the data in terms of programming is a very powerful combination. I think that we were able to see communities and states and really across systems, from the early learning into the health system and the use of some health population-based data and family serving organizations. The children and youth example is such a powerful one example of that, but really looking across systems and learning to understand and think about the data even beyond early learning in the school within community, and seeing communities become more sophisticated at understanding what types of levers of policy, funding, and implementation can do to address the data and head toward the results that the community is looking at. I think that this combination at all levels of the system of being able to see, use, grow in our understanding and capacity at all levels of the system to use the data and connect different types of data sets is just really something we could learn from the Australian system. Currently, with the use of the EDI in the U.S., it's more community or city to city, and I think that even within that context, this use of linking the data can be a very powerful tool for communities and funders. And I know we've had the school readiness data. Some states have developed reach and risk data profiles in order to drive funding. But this particular tool really added a richness and complexity that drove to the individual and the neighborhood the funding and resources necessary to address the trajectory. So I just think there was so much to be learned here and appreciated the opportunity to engage and learn together with folks about the possibilities.
Wonderful. Thank you, Debbie. So we'd like to turn the questions over and focus a little bit on equity now. And I think instead of going to the one that we have on the slide, why don't we go to one that's been submitted here on our widget. And this question asks, can you please provide examples of successful culturally sensitive interventions? And I think this person is also trying to get at sometimes behaviors may be associated with cultural values but may not be best for people's health. So it may be some inherent tension in there, and we're looking for an example of a successful culturally sensitive intervention. So Yasmin, you might be a great person to answer this. Do you want to take a stab at this one?
Sure, I'll take a stab, Claire, and I'm happy for others to contribute their thoughts. One of the things that I think is best probably to start with is to say that interventions that are best placed to address things in a culturally sensitive way are informed by the people that you're trying to work with. And so what we see often not working is when interventions are imposed on a community. So I will give an example of a community. This wasn't actually with the AEDC. It was started with our literacy and numeracy data. And this community drove their own intervention. A small group of grandmothers in a remote Aboriginal community had noticed some disturbing trends in literacy for their young children in school, and they applied for a grant to do some local community work to promote reading in the school, and they created all sorts of incentives for children to read. They promoted it at home, in the school, and they had a real shift in the number of children who were reading regularly and the number of books that children were reading, and it actually translated to improved literacy outcomes for those children in our National Literacy and Numeracy Assessment Program. And the Prime Minister even noted the change and went to visit the community to find out what was happening there. They didn't stop there though, so they noticed that the problem happened from very early on, and they saw at the community level people were not reading very regularly with their children and didn't understand the value of reading to very little kids. So they did a program to try and address that in the very early years. And what they first started with was actually turning people away from reading to their children, because it was sort of accusatory about what happens if you don't read to your children. So they really very quickly noticed through their cultural ways of working and being in the community and their relationships with people that they needed a changed approach. They changed all the language in their resourcing and their advertising, and they really shifted the rates then that children were read to before they came to school, and it's had a lasting impact on their literacy. So that was something that cost about $1,000 in advertising and printed materials. It was driven from the community. It was something that they noticed, and they empowered themselves to make those changes. So I think that that's really an important lesson. When we empower communities to drive change and to identify where they have the power to make change, that's where we're going to see lasting results.
That's a great example, really on point. Thank you so much, Yasmin. Anyone else want to take a stab at this? Ephraim or Debbie?
Yeah, if you don't mind, Debbie, I can talk about some of the stuff we're doing. So one of the things that we do in the United States that might be a little bit different than the Australians and the Canadians, and then maybe some of the other international partners as well, is that in the United States, the idea of a neighborhood or the concept of neighborhood is actually quite squishy. The borders themselves of what determines your neighborhood might be a little bit different than your neighbors. So what we do is before we even provide the data back to communities, we engage them in roughly about a year's long worth of work helping increase the resident as well as the community-based organizations and administrative leadership's spatial literacy. We talk about neighborhood and how to define neighborhoods that align with census geography so they can speak more clearly to make policy recommendations around the percentage of families that are in poverty or the number of kids who actually live there. And when they do that, they actually aggregate these in these community efforts. They define their neighborhood boundaries through a facilitated process that's usually facilitated by a resident that we train or partners, local partners that we train. And so the folks are actually naming the neighborhoods. They come up with the naming conventions as well. And so when they get their data back, they're already now they've received all this rich education in how to, think about place and how to quantify some of the challenges that they're experiencing. And then that actually leads them into be more involved partners in the developing the plans to improve their community conditions. And then the data then come to them, and then they can use that then to rally around support to actually enact their change. So our efforts here, because we're not national yet, they're more from the ground. It's grassroots as opposed to treetops. So having this grassroots approach actually allows for multiple communities across the United States to develop their own locally sourced cultural values that are inherent across these communities to actually inform the activities that are ultimately going to have some impact on early development outcomes.
Excellent. Thank you. Anyone else want to address that before we move on? Okay. If other examples come up, please jump in. I'd like to, another question that's come in that's interesting really focuses in on using these data to have an impact on legislation. So we've had a lot of examples about what happens in communities and community-led change, but we haven't as much talked explicitly about legislation or lawmakers, policymakers making changes as a result of those data. So we'd like some examples of that if you have any. So Yasmin, I'm going to start with you, and then maybe Kim, you may want to speak to this a little bit about whether these data are really a great fit for legislative changes or whether they're more community focused. But Yasmin, why don't we start with you?
Okay, so the first thing I probably should say is that both our Conservative and Liberal governments are very supportive of the data collection, and each for their own purposes, I guess, but it is informing agendas and discussion in policy circles. There is a lot of advocacy also from philanthropists who have the ear of government around early childhood, and the data is being used in state strategic plans. It's being used as a national indicator of progress in the early years. So it is linked into it's linked into things that people are held accountable to. I think that's probably important as a starting point. We often talk about it as, Fiona Stanley first said, the GDP of early childhood in Australia. And it's like saying, if you don't have a good way of measuring your tax base, a country is going to develop a system to do that because they need to know how much money they have. In early childhood, we want to know, we know it's important, but we want to know, are we making a difference? Are we setting ourselves up for a successful future, or are we going to have more and more problems as time goes by? So I think that's what policymakers are really paying attention to, is that future human capital, and that is why it is represented in strategic plans at all levels of government and across parties. That's probably not a very specific example of policy changes, but policy changes, as many of you would know, take time, and they're so one of the more recent things that has been debated is whether we're continuing this original sort of pilot or trial of universal access, so preschool for all 4-year-olds in Australia, and that funding has continued for now sort of year in, year out, and there will be future debates based on the research that's being done now about whether or not that's worth continuing to fund, who pays for it, and how it's rolled out. So those sorts of things are where the changes are happening.
Yeah,
thanks
Claire. This is Kim. I'm going to defer to Aoife next, but I'll just say that in the era of what, has been termed evidence-based policy, what we call evidence here in the U.S. has been so much driven by randomized controlled trials and so on. The space for population-based measurement as a driver, especially in early childhood, the question is, what are these tools and how can they play a role in policymaking has really been a question for me, which is why I really wanted to go see this myself. So when Sally gave the invitation to go see this and present at the conference, it was really compelling. And I think that's really a good question. So when someone like Elizabeth Groginski in the DC schools is working on this and putting population-based measurement into place to drive the work in the DC schools, again, hearing from Efren about his take on how this community-based work, which is where it began, Yasmin usually gives the talk from community to national, and that's something really for us to be thinking about here. What is the driver? And it's really what's happening at the community level. Folks are saying, we are doing population-based work. We are coming together to make change in communities. And when you have community-based work, you need community-based measurement. You need population-based measurement. So I think it might go actually the other way. And I wonder what Efren thinks about that, what you've seen as far as movement in legislation and so on, Efren, here in the U.S.
Hey, yeah, thanks for that. I agree. The importance of community is very, very. I think it's going to really maybe inform the U.S. story as we progress. But as it goes to local community policy, one of the cool things that happened during the time that we've been implementing the EDI is our city. There's a city in California, Pasadena. It's in Los Angeles County. They, like many places, had been trying to figure out what they can do to help create better environments in their city for healthy child development outcomes, knowing, of course, that it has some impact on their entire populace and their tax base later on down the road. They decided to develop something called an Office of the Young Child, and this is a cool thing. It's a cross-departmental organization. It's centered in the library of all places, but the partners are within the school districts and the health departments. And they have a staff person assigned to help them with their strategies to cross sectors so that they can address some of the silo effects that happen at at the level of the municipality that sometimes prohibit effective supports to kids. And so that was one of the cool things that they have. And if you go to Pasadena, the Office of the Young Child, Pasadena, California's website, you can read about their blueprint that they've actually implemented. And it's quite interesting, and it's a model that any of the folks on the phone who are interested in something like that can use. As it relates to statewide policies or national policies, obviously that's something that's not happening here. But one of the things that we've been using, the approach that we've had, this place-based approach, the importance of getting these cities involved in this very complicated space that we have here in the United States. Our director is working on something called All Children Thrive, and we were able to get a state-level investment for California effort going to actually create spaces so that the cities themselves can address some of the challenges as they relate to this issue of silos, addressing these issues of silos, getting community and resident voices to develop their improvement strategies. And so the momentum is building. But right now...
Thank you.
Okay, go ahead.
Sorry, Efren, to cut you off. We just have 1 minute left, and I want to say thank you to all of you who've joined, and Kim is going to wrap us up in just a second, but I'm wondering, I note that there are a number of questions that are fairly straightforward factual questions about the EDI, so we will try to include a link to more information about the EDI. We can add a slide to this presentation, I think, and this presentation will be available online as of tomorrow or possibly Friday. But we see those questions, and I'm sorry we don't have more time to get to them, but we'll try to get you some links so that you can learn a little bit more about the EDI. Kim, I'll turn it over to you to close.
Thank you. Thanks for attending today's webinar. We hope you've enjoyed our discussion. Please let colleagues know that it will be posted. Keep an eye out for the forthcoming brief on this topic. Please be sure to let us know how you think we did by completing the electronic survey, which will be available to all participants at the close of the session. Thanks to all of our participants, and have a great afternoon. Bye-bye.